California medical practices are facing a level of administrative bloat that has outpaced traditional staffing models. The daily volume of scheduling, patient intake, and insurance documentation has turned the front office into a severe operational bottleneck. Retaining the staff to handle that volume is increasingly difficult. According to a May 2025 poll by the Medical Group Management Association, 29% of practices saw their turnover rate increase over the previous year. Finding qualified candidates for the front office remains the single largest staffing challenge for practice leaders. In California, the pressure is uniquely intense. State wages are among the highest in the country, and the U.S. Bureau of Labor Statistics projects demand for medical assistants will grow 15% over the next decade. The gap between the supply of trained administrators and the demand for skills is widening fast. When a front desk is understaffed, the daily workload does not pause. It shifts upward. Physicians and clinical staff are forced to absorb administrative tasks like patient follow-ups and data entry. This misallocation of clinical time structurally damages the financial health of the entire practice. The problem is compounded by a common accounting oversight. Practice owners often look at the base salary of an in-house employee and mistake that figure for the actual cost of keeping them on payroll. This animated waterfall chart breaks down the true loaded cost of an in-house hire. A base salary of $35,000 is only the starting point. Factor in payroll taxes, benefits, paid time off, and turnover replacement, and that position costs $60,800 per year. This liability correlates to lost productivity. The final block links to a calendar, illustrating 13 hours per week physicians spend on administrative tasks. These lost hours are driven by heavy manual workflows. AMA data notes that physicians complete an average of 43 prior authorization requests every single week. Processing those requests consumes 12 hours of physician and staff time for every provider in a typical practice. This creates a compounding cycle of failure. Pulling doctors into administrative work contributes to a 63% physician burnout rate. When physicians are buried in paperwork, they see fewer patients. Patient capacity drops, and the practice's revenue strangles. To solve this, practices are moving away from the fragile model of the physical front desk. They are permanently shifting core administrative workflows to dedicated offshore virtual medical assistants. Virtual medical assistants, or VMAs, are healthcare-trained professionals who specialize in clinical protocols and electronic health record systems. They operate as accent-neutral English speakers, capable of navigating complex EHR workflows with the same precision as a local hire. Hiring in-house often creates single points of failure. If one person calls in sick, the intake process stalls. The virtual model builds redundancy directly into the system. Every client account operates with a team leader for day-to-day supervision and a process manager to ensure work continues seamlessly, even if an individual assistant is unavailable. Remote administrative support technology has evolved past its early limitations to meet the exact requirements of the modern medical field. Virtual teams now operate with the strict compliance and oversight necessary to handle protected health information without compromising patient privacy. Underneath the human element of these virtual teams is an invisible technological infrastructure. Artificial intelligence handles the workflow management, eliminating the need for your local office manager to manually assign tasks. Through Smart Assignment, an AI central hub analyzes incoming administrative tasks, instantly routing work to the virtual specialist with the exact expertise and availability. Simultaneously, continuous service-level agreement monitoring tracks turnaround times, using real-time performance tiles to automatically catch bottlenecks before your team notices. AI is also applied directly to patient communications. Real-time voice neutralization technology is deployed on live calls. This ensures every phone interaction sounds natural and professional, giving patients a calm and clear experience when they contact your office. By using outcome data and feedback to continuously calibrate workflows, the system functions as a self-improving infrastructure. Because it adjusts based on real-time performance metrics, the administrative engine becomes more efficient the longer it operates within your practice. An in-house hire carries a true loaded cost of $60,800 per year. A dedicated Staffingly virtual assistant drops that cost to $21,600, a 64% reduction. Replacing 3 in-house administrative roles with virtual assistants yields $117,600 in retained annual savings. Integrating this team happens rapidly. Systems connect to over 100 different electronic health records without requiring any new software. A full deployment takes just 48 to 72 hours. The security of the solution is enterprise-grade. The operation carries built-in HIPAA compliance, along with SOC 2 Type 2, ISO 27001, and HITR-US certifications, ensuring all data remains securely within your existing workflow via encrypted connections. Practices hesitant to alter their workflows can test the system through a 2-week risk-free pilot. There are no long-term contracts, and the virtual team can scale up or down with just 30 days' notice. For high-cost markets like California, maintaining an exclusive in-house administrative staff is an unsustainable financial liability. By adopting integrated virtual teams, smart practices are stabilizing their front offices, returning clinical hours to their physicians, and reclaiming their profit margins.